Well, just a introduction about our center in Odense. I have to stress that we are a team. We are a multidisciplinary team. There are many people involved. Uh, I I thought that this presentation should be named hyperinsulinism in the cold because it's usually very cold here in Denmark. But now we have sun, and so I skip this. Our center has received patients from a lot of countries in international collaboration, and especially from Sweden and Ukraine. And you will hear more about the Ukraine initiative later. And we had more than 100 international patients. We reached that milestone in March last year. Having a flow chart of patients, we've had, it's an old slide, from 132 with persistent hyperinsulinism, 75 got pancreatic surgery. And that's, of course, every center has a referral pattern that we get the most severe patients from other countries more than milder cases. So the rate of surgery is higher than if it was a population-based center. And that accounts for all that. If you have rates for brain damage or surgery, it depends on how your referral pattern is in the center. If you only get or mostly get the most severe cases. And the majority have classical focal hyperinsulinism, and that is still because from other centers they get the genetics that predicts that we have a focal lesion, as was told before, a mutation in the potassium channel from the father, from a healthy father, predicts very highly a focal lesion. So that's again an unbalanced representation of the disease. But we also have some atypical, which are neither focal or diffuse, and I think Klaus will expand on this later. Well, we are not only doing clinical work, we also do research, and both the research and the clinical work is in collaboration with a lot of Danes. Here mentioned some of them, and with a lot of international collaborators from a lot of countries. And this is multidisciplinary. There was a guy years ago, he said, parallel lines never meet. And that means that if you only work alone, you don't meet. If you go together, you'll meet and get more. And this is an example of this, a lot of international collaboration and collaboration with a patient organization, which is still growing. And that leads to not only clinical work with a lot of patients, but also a lot of papers on hyperinsulinism that hopefully should lead the field forward. When we got the Center of Excellence assignment, I think it gave us a lot of strengths. The patient organization gave us this assignment, and I think it helps for several reasons. Well, we have a quality stamp that can make others refer patients to us. It can also strengthen the international collaboration in research, because there is a collaborative research network in this organization. It will help the funding possibilities that we are approved by a family organization, because that's nowadays very important that the users, those with the disease, recommend what we do. Um, Also, unfortunately, we have economical cuts also at our hospital, at our department, and they're looking every day, where can we spare money, maybe on this hyperinsulinism, what about these international patients, or could we have this child discharged a few days earlier, and so on and so on, every day. But I think it's not only a matter about being smarter to save money. It's also about prioritization, and I hope that a Center of Excellence assignment is something that will impress our hospital to prioritize what we are still doing. This is a hope. Um, Lastly, it's important to recruit young doctors and molecular biologists, researchers to go into this field, because we always need the next generation to come. And we have young doctors here who are in it, and hopefully can be part of the next generation.